Thank you very much indeed to Nazim, and welcome to everybody. I'm super pleased that, all of us who are here. I want to say very special hello to Anna Main of Aotearoa. Now, why? Why am I greeting Anna Main? Answer, because I know that it's 3:30 a.m. where she is in what we call New Zealand. And it is such an honor that you're here with us today, Anna. I really want to make a fuss, want to give you some space, of course, but it's just wonderful. And thank you for having the courage to put on your camera and say, I'm here and I'm still a bit sleepy, but that's just too bad. That's what you get. Now we've got actually Catherine Deland is joining from the west coast of the US. It's early morning there. Frank Atherton's here. I know, I just saw you just now. And lovely, Frank, to be with you. Thank you for joining us. Lovely. And just a few other people to say hello to. I want to greet Annie Feltham, coming in from Colchester. I want to greet Nigel Lloyd from Cambridge. Marion Hasselgrave, thank you for joining. Miles Breeden from Kenya. Miriam Hirons, hello. Imam Ahmed from Canada. Mahika Acharya from Geneva area. David Holland, how do you do? Peter Hurst, welcome. Ad Spikers, I think still in Vietnam. Magin Muntefa from Gaborone in Botswana. Chrissy McNabb, I don't know where you are. This is the second time I've seen you recently. It's just absolutely lovely that we're connected again. Super. And yeah, very good. Karen Palmer, thank you for joining from Calgary. And is it your mum in the background in blurred or somebody else? Hello to Karen's mum. How do you do? Very good to see you. And Annie and Keith Appleyard, who I had the absolute joy of seeing over the weekend. Gorgeous that you're here. Joan Nichols as well. And Tessie, our team member, is actually in Antananarivo in Madagascar. Thank you for joining. Glad that the internet works. Alistair from round the corner, nice to see you again. And Gawaha and Marta, thank you for joining. Elaine Marshall, Holly Wheeler, great you're here. Karen Kaplan with Global Citizen. Now, here's what I propose to do today. I'm very keen not to talk for too long. There's so much going on. It's absolutely fascinating, COVID right now. Please, please don't anybody think or be deceived into thinking that we're near the end. I don't know where we are on this pandemic. Truly, I don't. But what I do know is that the challenges for policymakers everywhere are really, really difficult. Hello, Rebecca. Nice to see you calling in from, I suspect, Santiago. But yes, this is a difficult time for policymakers. What on earth do we tell our populations about this virus, about the pandemic? How do we explain the differences in responses in different parts of China and in Europe? How do we actually make sense of what's happening with the virus when we have no numbers that we can trust? And the reason why I'm very pleased indeed that Frank is here is that the United Kingdom is one of the few countries that maintains a population-wide sero survey. And so actually in the United Kingdom, the chief medical officers as a group are able to make assessments of what's going on. Special reason also for having Frank with us. In the last 3 weeks, he's been to Buckingham Palace and he met the Queen, who did a special investiture for British public health people, nursing people and others. They were kind of gathered together, and I believe they actually had the privilege of meeting Her Majesty. She doesn't do very many investitures these days. If that's true, Frank, I hope they'll say a couple of words about it. It might have been quite an interesting moment. And so, as I say, I'm not going to talk for a long time. Now, I want to stress that in my own interactions, which have continued reasonably well with media, with governments, with businesses, and we were in, Florence and I were in New York on the beginning of the week, and then we came back to Geneva. We were also in London last week and managed to meet with quite a lot of people involved in the public health community. We are being asked time and time again, hey, what's going on with COVID? And so the short answer is, this is not yet settling down into a nice, predictable, seasonal, relatively trouble-free virus. Kind of as we were predicting in these open online briefings, actually, this is remaining quite a nuisance in the form of a virus that resurges in its incidence about every 2 to 3 months. Of course, the periodicity varies, but it is very much a periodicity that reflects differences in the susceptibility of populations over time and the constant emergence of new variants that are capable of escaping the existing immune protection from immunization or past infection. So it's in fact quite a tricky equation that has to be thought through, very hard indeed to model. And some of you may have noticed the actual quantitative modelers have been a bit quiet recently because there are too many uncertainties for nice, neat quantitative modeling. Uncertainty one relates to the emergence of variants and the capacity of these variants to be able to evade immune protection in individuals, whether it's protection from past infection or from vaccination. But of course, we've got so many different vaccines being offered around the world, and we've got so many different variants causing infection that there's nothing simple about predicting the past immunity in an individual. And we have the extra complication that each individual's immunity is a very personal thing, and different people manage to develop either potentiated, what we call killer cells, lymphocytes that can actually kill, or antibodies. Each person does this in their own way inside their body. Summary is quite simply, it's incredibly difficult to predict whether an individual, when exposed to a lot of BA4 or BA5 Omicron subvariant, whether that individual is going to develop the infection, even if you know how long ago the person received their last vaccine, even if you know how much virus they're being infected with. There are too many variables. That's why many of you know people who had COVID just a month ago and seem to have got it again. It's not their fault. They've not done something stupid. It's just the luck of the draw. And so it's so important that we help people not to feel some kind of culpability when, after being like I was and Florence was, 2 years plus without COVID, suddenly getting it after our journey to Eastern Switzerland. Was it our fault? I just am not prepared to say it. I think it's very much the luck of the draw. And so the fact is, you get these surges, but who gets infected and how they're infected is hard to predict. But remember, older people are so much more likely to get severe illness. People with diabetes, people with heart disease are so much more likely to have complications, especially if they're overweight. And if you haven't been immunized, then there is quite a high likelihood, if you're older, that you will get severe illness when you're infected. Immunization, even if it doesn't prevent you being infected, seems to be really good at stopping you from getting severely ill or dying. In previous meetings, we've discussed whether immunization prevents you from getting long COVID. Unfortunately, we just can't say that it does. It looks as though some people seem to be protected from perhaps getting it through immunization, but it's so difficult to be sure. And I had to say quite recently to somebody, even if you had a quick reaction to your COVID when you had it at the end of last year, you might get it again in September. The fact that you had no problems last time cannot be used as a predictor that next time you get it, you won't get long COVID. So that's the big unfortunate thing, that we have no easy way to predict who will get long COVID and who won't, nor can we predict whether or not a subsequent COVID infection in an individual will have the same likelihood of long COVID as the last one. Very frustrating. And it's all because the collective knowledge about this virus is not enough to make the predictions that you and I would like to make. I want to be able to know how I can prevent myself getting long COVID the next time I am infected. I don't know. I've got a few ideas, but I don't know. Just a few things that I think may be true. If you are taking aspirins, statins, or other medicines like that to reduce the risk of small blood clots because you've got a stent in your heart like I have, or some similar intervention, if you're on these kinds of treatments to reduce the likelihood of a further heart attack if you've already had one, don't stop them, because there's just a glimmer of evidence that that kind of treatment does seem to reduce some of the risks of COVID complications, but it's still soft stuff. So I'm waiting and trying to persuade more people to do the kind of work that Dr. Ray Duncan, who we've had on these conversations, is doing to look at ways of reducing the consequences of COVID infection. Second is, if you've had COVID and you've got that terrible exhaustion that comes in the first few days after you get infected, don't try to fight it. If you get exhausted and you feel that you've hit the wall, stop, and if you possibly can, just lie down and let yourself go to sleep. The temptation is to fight it and to try to keep yourself strong. I'm sure President Biden is tempted to fight against the fatigue. I'm also sure that his medical advisors are saying, Mr. President, if you get tired, give in. Because what we're hearing more and more is that people who fight against the tiredness, who fight against the limitations on their ability to exercise, seem to be the people who get it lasting longer. So if in doubt, give in. For people who are a little bit inclined to laziness, like myself, that's quite nice advice. Physical laziness, I mean. So long COVID, haven't really got answers on the medical, but we do feel just don't push yourself when you've got it. I wanted to stress that I'm no longer reaching a point where I want governments to introduce compulsory regulations in the current situation, at least in Western Europe. I'd much rather that it was done through role modeling by senior decision makers and by role modeling and examples by senior decision makers and carefully justified, authentic advice. I'm increasingly feeling that mandates requiring people to wear masks or requiring people to get vaccinated just create terrible sense of injustice on the behalf of a small number of people. They get very angry and they lobby parliamentarians, and it generally becomes all sorts of messy stuff. Whereas I think if there can be more focus on dialogue at local community level with different groups, from civil society, business, the medical profession and others, just going through it and discussing it. Time and time again, I am finding when I have meetings on this, that people reach their own level of comfort about what to do. And when the numbers of cases are rising in their community, they are the first to say, yes, we need to get out, we need our money, we need to see our friends, we can't go on staying cooped up at home, it's very bad for us. But we are going to wear face masks, partly to try to protect ourselves, partly to try to protect others, and partly to send a signal that we're taking this seriously. All of us who've traveled know that a couple or a person or a family that are wearing masks are very definitely sending a message to the non-masked people, just simply saying, we're still taking this seriously. Secondly, do pay attention to physical distancing. Remember, these are hyper contagious, these new subvariants like BA4 and BA5 and the others. So just be careful. And I encourage people, don't feel you've got to go out and do close hugs. It's actually more respectful not to do it. I noticed that the fist bumping has come back into fashion, and I'm really, really keen that if you can fist bump, you do. So wear your masks if you possibly can, especially when you're in a confined space. Do try to avoid being too close, especially if it's an elderly relative. I know too many stories of people who seem to have been infected in that way. And then remember about ventilation. It does make a huge difference, having the windows open and clearing the air. And of course, try to make sure that everybody gets vaccinated. If they're not anti-vax, then I think people of my sort of age, over 65, should have had their second booster by now. And I don't think there's a case for any more, not yet, but that's what I certainly would be doing. Now, I wanted to say that I've been really interested in how societies cope with the consequences of COVID, in particular, protecting poor people who can't work because they're asked to stay at home. And I did a lot in meat factories in 2020, trying to understand what was the reason why meat factories seemed to have so many clusters of cases. I went into a meat factory, a poultry one, very interesting experience, and was invited by the management both to meet with them and to meet some of the workers and to listen to them. And they said, number one, there's something special about meat factories. It seems that the way in which the air moves around does make it more likely you get airborne transmission. They are places where the stuff spreads. Number two is that talk to your staff and find out what it is that are the factors that make it more likely for it to spread. And quite simply, people who work in meat factories are often super poor, but at the same time, they're picking up quite a lot of money. It's not nice work. They come in groups. They're brought perhaps from another part of the world to work in the meat factory. They do a stretch and then they go somewhere else, because you just don't do this for long, unless you have a pretty strong countenance. And then thirdly, they're going to go on coming to work unless they're paid an awful lot of money not to. I was hearing that people in the meat factory I went to were on £450 a week, take home, doing their overtime and so on. If they stayed at home because they were asked to isolate by the people involved in test and trace in the UK, they got paid £95 a week. And, you know, it's absolutely obvious that if they've got lots of money to send back to their family, if they're doing this intensive period of meat cutting work in order to make some money that will keep the family going for a bit, they're not going to go home on £95 a week or go to their digs where they're staying. You know, even if they're feeling pretty rotten, they're going to turn up and work if they possibly can, which means they'll probably spread the COVID. Or the point that came through in the UK was, if you want people to isolate, you've got to give them enough resources to do so. If you want people to be locked down. You've got to give them enough money to do so. Otherwise, they're going to do everything possible not to. And in order to make that possible, the approach that's used is something called social protection. Now, during the period 2020 to 2021, there was the most extraordinary amount of social protection offered in countries all over the world. Cash transfers reached 1.3 billion individuals, according to a recent study titled Cash Transfers in Pandemic Times that has been produced by the World Bank. That's what it looks like. Cash transfers in pandemic times. Very easy to find it on the internet. 1.3 billion individuals received cash transfers. The average coverage rate in low-income countries was much, much lower than it was in high-income countries. They tended to be of quite short duration, and a lot of the cash transfers were stopped before poor people got back into the kind of employment that they wanted, a general sense of unfairness from many of those who received them. The cash transfers were generous, but in general, they were not enough to cover the income that was lost. Governments had a lot of difficulty in getting cash transfers to people in the informal economy. 760 million were reached by digital cash transfers. There was a lot of building on pre-existing systems and some use of new systems, but not enough. And perhaps the most important finding was, could cash transfer planning be done in between crises? Because trying to build up a massive global cash transfer operation is a very difficult thing to do. The reason why I'm so interested in this is some of you know that I'm on the UN Secretary General's Global Crisis Response Group, looking at the interaction of the disturbances in food, energy and finance systems. And one of the things we're trying to do is to quickly learn as much as possible from COVID social protection in order to think what can be sort of built up for the cost of living crisis social protection. And we're looking at that very, very hard at the present time. But I thought that you might like to hear about this piece of work. Lastly, I am being asked increasingly, what do I think about vaccination for children as part of the strategy for COVID? And I want to say very, very clearly that vaccination of young children, I don't think is anything like as important as making sure that older people are fully vaccinated. Now, I like to share good news. In our work to try to deal with the cost of living crisis around the world, Antonio Guterres, the Secretary General of the United Nations, decided after he'd been reading some of our early reports in April this year, that he did want to try to initiate what he called a package deal to get grain that is stuck in the warehouses in the ports in the north of the Black Sea out of Odessa, particularly onto boats, so that that grain can come onto the market and help deal with a terrible problem we've got of increased food prices around the world, which is partly to do with speculation, but partly to do with tightness in the vegetable oil and wheat markets. And an enormous amount of underground diplomatic work has been done in Russia, in Ukraine, in Brussels, in New Washington, in Turkey, and so on recently. And I'm just so delighted to tell you that we've got the first step, and it's only a small step, which is the signage of the agreement under UN auspices. The UN Secretary General was there, between representatives of Ukraine Russia and Turkey to move towards moving some of this grain out by sea, because it's too much to go out by land, and it happened just about a couple of hours ago. And so my phone is going crazy with people actually terribly pleased. It's amazing to have good news. And to my friend Palita Abikun, who's just joined, who's one of the COVID special envoys made by Dr. Tedros. He and me are both COVID special envoys. Palita Abikun is also a senior public health official from Sri Lanka. He is living through a really difficult time in Sri Lanka. They, as you know, they've just had the president had to resign after being chased out of office. They've had protests in the street. They've got very big, difficult situation with foreign exchange and a big risk of malnutrition. Palita, welcome. Any thoughts from you? Thank you for joining so late at night. After you, I want to go to Frank Atherton, and then I go to Peter Hurst.
Thank you very much, David. Actually, I do not have anything to add on this. Brilliant presentation as always, David, as only you can do it. Of course, I'm quite used to it because our weekly Tuesday discussions, I've heard a lot of it, so that's very good. But from our perspective in this region and the countries that I have little information about, again, we have getting another cycle, David. And of course, the good news is that, like you said, people who have had one or two boosters seem to either get very, very mild, or it does not even become symptomatic. So that's a good thing. But even so, we have had some serious cases. And now the new variants, my clinician friends tell me that they seem to affect the lungs more directly than we thought earlier. So that's not good news. But we have also had in some of the elderly people who were unable to get them fully immunized, we have had a few deaths, but fortunately not as we saw before. But what I want to say about our region in this aspect, David, is that we are still not over it, like you said. It is not going to be over just like that, which means, as we have done, firstly, as you just mentioned, we have to observe as best as possible the public health measures that we were used to or we were observing earlier, which now have become a little bit, we are a little lax about it. People are taking it a little bit easier and neglecting that. So that's something that might be worrying. Secondly, I think we also have to still keep on hammering this message that the community engagement is very important, and we have to work a lot at that level, because because of other things now. For example, in my own country, because of all these other issues that you mentioned, I will not discuss them now. I'll talk to you on that sometime later, David. We are also seeing that COVID itself is slowly getting to a side of the radar. It's not, I say 1 year ago, it's not the main item on the radar. We have other things that people have to worry about. So that's also issue that we have to remember. I think we have to go on like this, at least this year. And I don't think we can really relax. There's no way we can relax for a while more. That's all from me, David. Thank you very much. I will talk to you on the other issues with regard to the food and nutrition issues, which we had discussed very briefly earlier. I'll make a call with you sometime very soon. So once again, thank you very much. It is always good to listen to you.
Thank you. And what was that church bell in the background?
Sorry?
What was the church bell in the background?
Oh, that's there. Oh, that's interesting for you. That's the Kathmandu. It's on Kathmandu. That's the Swambhunath.
Oh, I see. That's where you are. Excellent. Thank you very much indeed.
Yeah, thank you.
Okay, so just to Frank Atherton, then Peter.
Yeah, thanks, David, and thanks for the overview as ever, and thank you for the recognition. I was up at the Palace. Yeah, I actually met the Duke of Cambridge. He was doing the honours when I was there, but the Queen also a week later did honour the NHS in the UK by awarding the George Cross to the NHS, and that was just a fantastic thing that she chose to do that. So that was lovely. I mean, just the context in the UK at the moment is really interesting. As you say, it's a fascinating virus. But you know, we're still in the BA.5 Omicron wave, and we're probably just cresting that wave, but at very high levels of community transmission. You're right, the ONS does a survey, a community-based survey, and in Wales, where I work, 1 in 17 people are are positive as of 2 weeks ago, and that's something that I always kind of personally bear in mind, because I don't go to those big crowds, as you say. I try and avoid them. I always think 1 in 17 is affected here. So we are cresting the wave almost certainly, but my anxiety is the one you've flagged really, which is the periodicity. We thought it was going to be every 3-4 months maybe, and it's looking like potentially things could be much quicker than that. So there's a real risk that we get into the winter months. We're watching obviously this BA.2.75 very carefully, and there will be other variants to come. So the worst case scenario is a resurgence of flu in the winter. We're already seeing relatively high rates of respiratory syncytial virus among kids here in the UK, and if we have a surge of COVID at the same time. And the problem is, of course, that as these waves come closer and closer together, there's just no time for the health system, the social care system to relax and to recover. So that's a fundamental worry. David, you talked about the policy choices that people have to make. Well, politicians fortunately have to make decisions. We can only advise them. But some of them are around testing. The world of testing has really moved on. We still, in Wales, we still test people going into hospitals, but we don't test asymptomatic people in hospitals. We've found that does more harm than good in terms of the other harms caused by lack of access to health systems. We still test health and social care staff on a twice-weekly basis to have access to lateral flow tests. We still allow people in the community, we provide free lateral flow tests to them if they are symptomatic, but you can't go on with that forever. So there's decisions that politicians have to make about when you stop some of those things. Second thing is surveillance. I'm really glad you mentioned the ONS. It is a jewel in the crown. It's very useful, although there is a caveat there. I really think we've crested the wave because our hospitalization rates are coming down now. The ONS figures are staying static. And I think part of the reason for that is that the PCR tests which they use can actually be long, positive for a prolonged period of time. So we just have to, as ever with data, you have to look at multiple sources. In fact, the wastewater survey is quite useful. We also have a siren survey where we look at healthcare workers and periodically survey them. And we're currently boosting our capacity for sentinel surveillance through primary care and sentinel surveillance through hospitals. So surveillance is absolutely critical going forwards. Vaccines, I mean, the questions there, the policy question there, of course, is, how frequently and when do you time the boosters? There's no doubt that the vaccines are not very good at stopping transmission, hence your point about why give it to lots of healthy kids. I agree with you entirely on that. Give it to sick kids or kids who are vulnerable possibly, but it's very good. The vaccines that we have been very good at not completely stopping, but at weakening that link between high levels of community transmission and harm in terms of direct harms in terms of hospitalizations, ITUs and admissions and deaths. What then we don't know is the impact on long COVID. So with these high rates of community transmission, I am worried about the long-term effects of that. And then the final policy choice is the one you've also flagged, which is about how do you break those chains of transmission without putting in place draconian measures like lockdowns and social distancing measures and legislation around face coverings. And I think, like you, that we need to move to perhaps an expectation. I think it's reasonable for people going into a hospital with these rates of community transmission to say, in a hospital setting or a care setting, it's an expectation that you wear a face covering. And it may be, when it's high, that there should be an expectation on public transport. I was in London, I was on the tube. I was probably one of the only people wearing a face covering on the tube, So very interesting times, worried about the winter because of flu, because of COVID resurgence possibly, and also the cost of living crisis. And although we're coming out of a heat wave now in the UK, I'm really worried about the cold weather and fuel prices and the fact that people will inevitably be turning down the dial on the thermostats, and that will lead to some adverse health impacts as well. And it'll be the poorest who are most hit. I'll stop there, David. Sorry, there's a lot in there.
No, but thank you for being with us. It's lovely, and you know, we know a lot of responsibility you and your other chief medical officer colleagues are carrying, and it's very, very good of you to join us and share some of these with us in a nicely contextualized manner. We've got one or two people on who are authoritative about long COVID, and I saw Claire there just joined, and I think others as well are either experiencing long COVID or whatever, and I would like to run a little set of comments on long COVID. I will go to Peter now, but Catherine, if you wouldn't mind sharing with me, and I do want to ask after Peter Hurst, and then I want to go to, if she's still here, Hetty Schoenfeld. I just don't know whether you are still here, Hetty. Peter, please.
Oh, right, thank you. Thanks, David, for all your work and for the update. I just wanted to pick up on your comments on the meat industry. One of the reasons why agricultural and food workers have continued to go to work during the COVID crisis is because there is no statutory sick pay in many countries. This is one of the elements of social protection that you mentioned that's missing. Now, social protection gets defined differently. The International Labour Organization will define it differently from the Food and Agriculture Organization. But basically, it's reckoned that in agriculture, less than 20% of the agricultural workforce worldwide have any form of social protection. And it's things like sick pay, pensions, health insurance, and the like. One of the responses, one of the governments that's responded to this problem has been the German government. And in the meat factories in Germany, we had cases where a 7,000 strong, out of a 7,000 strong workforce, 1,500 to 2,000 workers got COVID, which not only closed the factory, but the whole of the surrounding community and area. One of the problems was East European workers being recruited by subcontractors in Germany who didn't enforce really any decent labor conditions, including any COVID protection. As a result, the government has passed a new law, which means that no employer in the German meat industry can he or she must directly hire any migrant labor. They cannot pass through subcontractors. So the point I'm making about this, there is a labor aspect to the whole of this. And if we're dealing with COVID or future, future epidemics or pandemics, until we get the basic things sorted out, we're always going to be in a difficult position in industries, in the food and agricultural industries. And just to finish off, last year, Guy Ryder, who is the ILO Director General, is on record at the United Food Systems Summit, and he made a presentation and he said, many governments consciously and deliberately continue to exclude agricultural workers from basic protection under labor and social laws. It's an issue we're going to have to deal with, but until it goes away, things like COVID will always have a greater impact in industries like that. It's not just, it's a wider issue that we also need to flag up. So thank you.
So Peter, COVID, the great revealer. It shows the terrible weaknesses in our society. Peter, where are you at the moment work-wise? Perhaps you're retired, and so that's an inappropriate question, but I bet they'd like to know the group.
I am retired, but I used to work for the International Union of Food and Agricultural Workers. I was their health and safety specialist for many years. And I used to work for the International Labour Organization. I was their hazardous child labour specialist. I'm still very active on, working with bodies like ILO, with the FAO, working on health and safety issues. We're looking a lot at the banana sector at the minute as an example of food supply chains, and we're just looking at general labour conditions. We've been helping out on COVID, and I know the good work that you did with IUF on COVID. So thank you very much. For that.
Well, that's one of our most joyful interactions.
Yeah,
is with Sue Longley and James Ritchie, and then Unite the Union and others. It's been wonderful.
Yeah. Well, Sue used to be my boss for 6 years. So.
Oh, right. So thank you, Peter. Sorry, just to keep the conversation going, Peterhouse is part of a group in this community that are working on the rights and opportunities for workers in the food sectors. And just want to say that Anna Main, as one of our organisers of food systems dialogues in New Zealand, in her case, has been involved in this. Anna, if you want to speak, after I've come to Claire Rayner, I'd come to you. But if you'd rather not, just put something in the chat, or if you can't do the chat, when I come to you saying, give me a break this time, and I'll happily do so. Oh, you're okay, good. Claire, welcome. How's things going?
Not too bad. I'm so sorry. I'm just dashing in and out of another meeting I had to be at. So I haven't heard everything you've said, but I know it's the last one. Yeah, I think I'm hoping that we will release next week from the Society of Occupational Medicine a position paper on long COVID and what works. It's going to be called Long COVID and Work, What Works. Really, it's my excuse to get out a whole load of appendices on how to manage it and prevent it. And of course, we've used David Fedson's input with that, and people like Ray Duncan. So there's a lot of, the thrust is going to be, listen, can we get some early intervention? Can we deal with those early symptoms? And now we've got this huge economic impact, which is only just now hitting the media in the UK this week. So it's finally dawning on people. So, yeah, so I'm concerned about all the people that are being affected. I'll let you have that document when it comes out.
It's absolutely great that you're doing that. Absolutely great. And you have been so important in this group. In helping us to put long COVID on our maps long before it was on the map of international institutions or the media. And we need to keep focusing on it. Long COVID is a variety of pathologies with a mix of syndromes characterized by prolonged disabilities after infection, but manifesting in lots of different ways. Let's try to box it all up into one picture, keep it broad. And I did say that the one thing that we are advising our friends is don't push it too hard when you're getting in the recovery space, because for some reason that seems to almost accentuate it. Go on.
It really does. And I think that's one of the absolute #1 messages. It's longer than you'd think with a virus. And that's what, looking back, people say, I wish I'd rested in those first 2 to 4 weeks even, I think, really. Yeah, so I don't know why, but absolutely it's a key public health message. So thank you.
Thank you. So Hetty Schoenfeld is on. And I'm not sure where Hetty is, and I heard she might have to leave soon, so she might even have left and not be behind that photograph anymore. But if it's the Hetty I know, it'd be lovely to hear what you're up to and what your observations are on COVID these days.
Hello, yes, sorry, it's not the perfect shot, but yes, COVID is very much with us. We've just been to the summer school in Leeds, where 6 of our participants from Africa had to tested positive and had to self-isolate. I myself had COVID twice, and the Omicron version of it, I've been totally vaccinated. and I'm healthy. I exercise, and it didn't protect me. I was really very sick the second time again. So, which, you know, raises your, and I totally agree with you. Rest is the best thing. I mean, it's with Omicron, I had these watery eyes, which was a very distinct feature of it in the South African version. And it meant that I couldn't read. I couldn't look at my computer screen, and I just slept. And I also lost my taste, which is not usual. And but you know, zinc tablets really works. As one thing that COVID has learned is that maybe perhaps there is something in supplements where most nutritionists, we normally just say eat a healthy, balanced diet. So yes, so we in South Africa have now abandoned mask wearing, but we still continue with the good practices of, you know, good hygiene, cleaning your hands, entering a building. Yesterday, I was with my daughter at the university because they're starting a new semester. And she was just saying, Mommy, everything smells like it's been bleached. And it's because they've cleaned out all the buildings in preparation for the students that are coming in, 40,000 students coming in on Monday from all different parts of the world. So thank you. I've really enjoyed, I mean, I've just heard from the previous speaker that this is the last
well, it's the last in this series, Hetty. We'll go on.
Oh, just in this series.
Yeah,
okay.
I'm just we're going to take a break. So this is Hetty Schoenfeld, who I've known for years, who's an absolutely brilliant nutritionist, part of agriculture and food policy. I don't know whether you're still there, but you were at the University of Pretoria. And I mean, and we've got such a lot of brilliant friends at the University of Pretoria, and it's such a brilliant university, and it's lovely that you've joined us. And if you find it useful, come again and bring your friends.
I've been here a couple of times.
Oh, brilliant.
Don't worry.
I hadn't noticed you. Yeah, thank you. Thank you very much for being with us and for telling us the story. And I hope all goes well with you. Anna Main, tell us what you're seeing. I mean, we've been together because you did some of the most amazing food systems dialogues in New Zealand. And although one imagines that everything's all super calm and easy in New Zealand and everybody's happy and so on, there are a few issues that are being dealt with, and they're getting more tricky on the COVID stage. The Prime Minister has been amazing, but she gets it a bit from people, and would be very interested to know how it's going right now. Anna, please.
Kia ora koutou. Hello, everybody. Thank you for your kind words, David. Everybody, just to give it context, my introduction to the food system dialogues was actually through, it was February 2020, February the 6th, and Prince Charles, England, gave an incredible speech at the 50-year anniversary of the World Economic Forum. And it's on YouTube, and I encourage everybody to hear that speech. That is a future king's speech. And I didn't know at that time, for a bit of a laugh, that speech was part of a food systems dialogue in Davos at that time. And I'd only heard about the food, or read about the Food System Dialogue Initiative, and your brainchild, David. Thank you so much, because it was on Facebook. And I thought, wow, what an initiative, what a platform to give people voice. And so we ran the first one, thank you, David, in June 2020. And then in the November, you opened it up to independent ones. And look, we've run 6 of those. I haven't put the report up on the website, but I shall soon. It's just being proofread. final proofread. I always get 2 people to proofread. And we've actually run 6 independent Aotearoa food system dialogues. And we also hold wheel spoke dialogues for any issue that needs further work. Between the, I've set it up so there are 3 keystone events, March, June and October, the first Friday of those months. And David, I'm happy to tell you, I do want to talk to you about COVID, but we've actually committed to 15 years of food system dialogue work out to 2035. I'll turn 60 and then I'll pass the reins over. But what I'm finding in Aotearoa, New Zealand, is that the Māori people, our Indigenous people, through COVID, have really come together in their culture and the doctrines of their culture. So the first one is Aroha, which a lot of people call love, but I asked Kaumātua, who's an elder out here of Ngāti Wai, which is the water people tribe, and I said, Hori, what does the Aroha mean? And he said, Ina main, it means outward compassion for all living things. And this is the heart of the Māori culture. And regarding COVID, we've had the most beautiful experience in that, even with the hardship of sickness and in death, the unity of what are called hapu, or local family groups, that's HAPU, local family groups are like an extended family. And of course, Māori are sovereign out here due to the Treaty of Waitangi. And so for everybody, it's been a nice reminder of these local groups, or these larger family groups, of course, which sit on a block of land or look after what they call a rohe, R-O-H-E, a block of land and of course waterways. So when you introduce yourself out here, you say, my mountain is, my river is, always referencing the land and where the food source comes from. So just on COVID, it's ramping up out here at the moment. But we've had, you say climate, COVID is the big reveal. And it is showing a lot of gaps in social injustice and things, but that's where the opportunities are as well. So we've had the local iwi, which is a tribe. So you have a tribal group, and the smaller groups are called hapu. And Jeff, my partner, and I, we live in a wee tamarillo orchard up in the far north. And, in the first year, 2020, we were provided a huge box of food and necessities from the local Māori people. All the people in the area were given help. On the food systems dialogue, I'm very, very pleased to report that we've had some tangible progress in social inequalities out here, and that I've been able to educate and embrace and suggest that leadership roles come from our Indigenous people. And so we run 4 tables and we have co-facilitation taking place. So we have European, Pākehā, and Māori co-facilitation, which means it's great because we have sovereigns at the table. So the other great thing I wanted to say about COVID, where the opportunities are on a local level, is one of our facilitators, Kelly Francis, called Whenua Warrior, has started up a business where she's actually encouraged 600 poor families in South Auckland. There's a lot of poverty in Aotearoa, New Zealand. And we have, agriculture has hit us hard with our waterways. So it's not all, it is paradise out here, but it's a degraded paradise. And we need to work as much as hard as any other country to restore our waterways and health. But anyway, Kelly has helped 600 families build gardens in their backyard in the city to grow their own food and get resilience. And of course, it's nutrients from food that'll give immunity. But just before I go, look, David, thank you for your brainchild of the Food Systems Dialogue. We're going through to 2035 because there's actually 2 documents here that run New Zealand. One is the Treaty of Waitangi 1840, but there was one step back, which sort of a bit lost in time, 1835. Which was He Waka Putanga, the Declaration of Independence. But can I just have a show of hands, or if you could just put your a thumbs up if you have read a book called Donut Economics. Because I think that donut economics and circular economies and local economies are our future. And I hope to be talking to you more about ideas for that as time goes on. So Donut Economics, if you haven't read it, it may be a good idea to do that, because on page 240, Kate Rayworth, brilliant British woman, has asked for a panoply metric to be created, and we think we may have cracked that. But back to you, David.
Thank you. Marvelous. 4:30 in the morning or whatever time it is. This is Anna Main. Now, Anna's talking about the food systems dialogues. It's we realized early on that you can't shift complex systems simply by berating people and telling them to think and act in a particular way. Even if you have masses of power, it doesn't work. But instead, with the advice and guidance of John Atkinson, who's here with us today, we developed a method of structured dialogue in which people from multiple places in society would come together and work on where they want their food systems to be by a particular time in the future, 2030, or in Anna's case, 2035. And then through a mix of techniques, including facilitation, according to 7 principles, and then summation of what happens at the dialogue tables, an enormous amount of energy is unleashed, trust is built, identity is reinforced. And we have got examples from actually 110,000 people who've taken part in these dialogues of real change taking place. And anybody who's interested, the website is www.summitdialogues.org. And when Anna says they were proofreading their feedback, this is designed to be a space where the results of dialogues, the synthesis of dialogues, and even the pathways to the future that are produced as a result of the dialogues can be shared. And so it's with this that I go to John Atkinson, who is our systems leadership guru. Thank you for putting it in the web, John. Just to give his reflections on our conversation today, things that we've talked about, and advice. And then I'm going to go to Mahika Anderson and Catherine Deland. I'd like to go to both of you for any reactions, and Mahika for just telling you when we'll do our next one. We'll last through till about 35 past the hour. It's now 18:28 in Europe. John, please.
Thanks, David. So I'm going to go back to, I think, where you came into this, which was about, you were noticing how about every 3 months we seem to get another wave of stuff happening. And that got me thinking about the importance of patterns and our ability to see patterns in all the multiple activity that's going on at any particular time. Because patterns are a way of making sense of complexity, a sort of shorthand for predicting what future scenarios might be, and they therefore give us a perhaps more intelligent way of saying, well, what might we be, what maybe could we be doing or should we be doing now? And in order to see patterns, it's really important to keep track of things over both time and space. So what happened previously? Well, last time we had hospitalization rates at this number. What was going on? What did we learn? When was the previous one before that? How does it look different? What's happening in other places? They're different to us. They won't be exactly the same, but what can we learn about what's happening around the world? What's happening in New Zealand and China and Argentina or Chile that might be interesting to inform what's happening here? And what's happening in other systems, because stuff's happening, all our systems on this planet are interconnected. We're seeing stuff in food systems. We had an amazing conversation earlier this week with some African leaders, and they about food systems, and so many of them started off with, and after COVID, just COVID was the frame that introduced the way that they were thinking about the system that they were now in. So food, fuel, finance, to name just some Fs, all going to impact on other things. So we're paying attention to the information that we're seeing and the importance of sharing that information, but we need to be mindful of our filters. We screen out things we don't like or that just don't compute with our current world. And if we're able to get past all of that and start to see pattern, then one, it tells us a lot more about what's happening for us as individuals, but it enables us to make much better sense of the circumstance we're in and make those more intelligent choices about what we might do. And that's what I think, David, when you're referring to about what are people doing in London about wearing masks is different to New York, people may be seeing the pattern a little bit differently and therefore making different choices.
Thank you so much. While I was in New York on Monday and Tuesday this week, the buses suddenly started putting up right at the front where you are shown the destination, masks required. It wasn't you are requested to wear a mask. It wasn't any picture, just those two words. And yes, everybody was wearing masks. And the case was made on the television that this is fundamentally actually to protect the bus drivers. Very important point. And John, thank you. It's what you see in terms of patterns is hugely important in what you do. And one of the things that we've been doing with John through the dialogues and then the synthetic work that we've done to pull together the results of more than 1,600 dialogues of the kind that Anna was talking about is focusing on patterns. So thank you for bringing that up, John. Could listen to you forever. But I have to move now towards the end because I don't like going on and on. So could I invite Catherine Deland and then Mahika. Catherine, please.
Hi, everyone. Thanks so much to everybody for your time today. Just as a matter of housekeeping, to remind you all that this has been recorded and will go up on the website. So if you have anything that you'd like to have us edit out, do send us an email. I'll make sure that I put my email into the chat before I go. But more on the substance, just to mention that I think David and John and all of us have spent years, really trying to think about being systems thinkers. And I think this conversation that we're having in the OOBs that's moving more towards linking COVID with labor and with food and with everything else is such a lovely way for all of those pieces to come together. Really challenging, and I think probably a better way for us to be thinking about it than if we were just being siloed or linear. So I appreciate everybody's really willingness to dig into this way of thinking and this way of approaching things. It's lovely to see you all. It is morning in California, but I know it's late night and midday and evening elsewhere. So have an absolutely gorgeous weekend to everybody.
Thank you very much indeed. Now we had a little added thing just saying don't forget about climate change came from Rebecca Cantor. And gosh, yes, there's been some stark reminders in Europe, particularly about how this is very fierce. I thank you very much, Catherine, for joining when you are in, I think it's
It is, as always, a great pleasure.
Are you in Los Angeles? I think that's where you are, or is
I am indeed. I am only inches from the beach, which is a lovely place to spend a little bit of time.
Brilliant. Oh, how lovely for you. Excellent, excellent. Could we go to Mahika Acharya, please, particularly to talk about the start of the next series and any ideas you've got for the next series?
Yeah, thanks everyone. This was our 120th episode of the Open Online Briefings and the last episode of Series 6. Series 7 will start after summer break on the 26th of August. So it's also a Friday at the same time. I will send an update on Twitter, Facebook, not Facebook, LinkedIn, and also the newsletter. But of course, if you have any questions or if you have any comments before that, any suggestions, do write in to me or to Catherine, and we will get back to you. And yeah, so thank you once again for joining, and all the best and the best of health for you and your families.
So thank you. And to those of you who have joined through most of these sessions. That is great. Mihika, how many of the videos are currently sort of watchable on the website?
They're all watchable apart from, yeah, so I'll put this up next week and they're all watchable, but I mean, they're on the 4SD website and they're also on our Twitter account. So I've shared the last video on that. If you click on that, you'll go to our YouTube channel and you'll see the whole list.
Thank you very much indeed. One of the reasons why I was really interested in that is that they are quite a history of changing thought through the pandemic. And I mean, many of you, Annie, and just looking at the top of the screen, Annie Feltham and Marianne Hasselgrave and Loy Rago, you've been at many of these, most of them. Gawaha, you've been at most of them as well. I'm very keen, if you want to and you've got the time to spare, do have a look, if you like, randomly or not, if you can remember certain days when you were particularly inspired, and just see whether you find having this historical record through the pandemic is useful. It's something that I would like to know about, because of course it's useful for me and for John and others on the 4SD side, but we're more and more interested in what helps people to think through systems approaches to dealing with complexity. And much of what we've got to do, both in our work in 4SD and in my own involvement in Imperial College, is to work through how we can teach this better to others. And we will go on doing that. So with that, I'm going to say thank you very much to everybody. Have a really lovely August. If you take a break, we'll think of you. And look, let me give a special mention to somebody who's cut his hair, especially for today, Gregory Hartle. Gregory is right at the heart of WHO's communications and is supporting the Special Envoy group. And just, Gregory, you could possibly have the last word if you want to say anything.
David, I wouldn't want to take the last word away from you, so you must say something afterwards, because you are the fulcrum, the center, the star of all this. But I mean, they are extremely useful and helpful, these discussions. And I hope, and I'm sure that we will continue working together going forward to find ways of somehow communicating and making inroads on a lot of issues which are still really important on COVID, like long COVID, like misinformation, and how, with the resources we have and the resources we would need to reach communities, because communities is where you are going to have the biggest effect, one by one, in terms of increasing not just COVID, but general vaccination rates. David, thank you very much.
Thank you.
And have a great summer, everyone.
Okay, and with that, bye-bye all. Thanks to everybody behind the scenes. Huge amount of work. Thanks to all of you.